that in the event coronavirus cases rise, Wilkins and Beatrice infectious disease hospitals will be overwhelmed. As a follow-up to that, Vice President Kemo Mahadi, who chairs the Interministerial Ad Hoc Committee on COVID-19, held a meeting with senior doctors who then insisted that Parenyathwa group of hospitals is the best place to treat COVID-19 patients.
So they said that we should actually think of refurbishing Parenyathwa. And I agree with them that we need to Parenyathwa. But they went further to say that since Parenyathwa is a hospital that also admits people that are non-COVID-19, so it needs to be
hospital into a premier COVID-19 management and treatment center is underway. Engineers are working round the clock to ensure that in a fortnight it will be ready to treat COVID-19 patients. The hospital will be split into two sections, the red zone for COVID-19 patients and the green zone for patients with other ailments. This section here will be the critical care center where COVID-19 patients will be treated here at Parenyathwa. Right now there's a lot of dirt and disorder in the room because there's a lot of work being put into it by engineers and a lot of other workers that are putting all hands on deck to ensure that this place is spruced up and ready to start admitting patients in the next 2 weeks. When transformation work is complete, Parenyathwa group of hospitals will be able to take in a total of 425 COVID-19 patients. This is slightly less than double the capacity of Wilkins and Beatrice infectious disease hospitals, which carry 60 and 160 patients respectively. The critical care center will have a total of 27 intensive care beds. The hospital's management is optimistic that their plan.
So there you have it. You've been seeing, we have been on the ground, we have been interrogating issues, and back to Twitter where we've got people saying we will be tuned in, we really need to see this. This is Tinoda. We really need an extension, says highly favored. And Tatinda Zindoga says more testing needs to be done. Let's just say that I think extension will be the way, the go-to option. If they do partial, would like to know what they would consider worth opening. Either way, people are just going to be upset, certainly, and that's what I've been talking about. It's going to be upsetting. Whatever you're going to hear today is stuff that you don't want to hear. You're probably going to hear that there's no extension and it's business as usual, but you don't want to die. Or you will be told there's a full lockdown and we're continuing like this and you don't want to go hungry. Either way, nobody wins, and the only thing that we need is to make sure that COVID-19 is the biggest loser today at wherever will be said at State House. Takunda Vitalis says virtually partial lockdown or else full lockdown, 2 more weeks is predicting. Lifting the lockdown is not an option. That's according to Takunda Vitalis. And Mamboloti is watching us from Mtoko High. Certainly we are following you, and as you follow whatever is happening right now, I'm going to have and it's interesting that somebody is actually watching us from Togo, because after this I'm going to tell you what's happening in the rural areas, because we're complaining from the urban areas. We're saying we don't have food, we don't have access to certain basics and basic commodities. But imagine what's happening in rural enclaves where of course that lockdown is also being practiced and is also being extended to, because this is a nationwide lockdown. But before I show you that, perhaps let me take you back on that diplomatic passport to State House. So there you have it. Maybe they're actually going through your tweets and responses to ZTN, because I would like to tell you this, that our leadership watches ZTN because we lead the discussion. So whatever you guys are saying here, you actually influence the corridors of power. That's how powerful you are as our viewers. And as you see, there's a bit of a flurry there. There's stuff that's happening right now, and they are following what you guys are saying, and they're probably scared, because either way, you don't want to be that person behind that podium telling people that you're going to have to extend by 1, 2, 3 weeks or whatever news it is, because whatever news we're receiving today, it is not good news. Mew Ainona says she doesn't want another Asante Sana. She wants to get information that's going to make her happy, or that's at least going to speak to her. Of course, as I promised, let us move from State House right now and let us go Kumabuja, Kwamchoko, and see along the way, because we actually traveled as diplomatic passport. While you were in lockdown, we were allowed to go and see what's happening there in the rural areas, to actually empathize with the rural community and see how they have been experiencing this lockdown. With the lockdown in Zimbabwe being affected, the question was how the message had reached the key rural communities. Mutengwa in Zimbabwe's northeastern town of Mtoko is one such place where people gather. Considered a holy mountain, it is the place where the Englishman widely regarded as a Catholic saint-elect, John Randall Bradburn, lived, prayed, and died. Now thousands gather there each year to pray, seeking intercession and a meeting with God. While there may be lockdown, when our team arrives, the faithful are gathered in spite of the lockdown. It is prayers as usual. However, on the morrow, lockdown sends its word up the mountain of God. The authorities, soldiers and police, are rumored to be on their way up the mountain. The people do not wait to test the patience of the authorities and start to make their way down the mountain. What was supposed to be the start of Holy Week, with the religious going up to meet God on Palm Sunday, becomes an unceremonious departure from God. And today is Palm Sunday. Usually, this place will be packed with believers, Catholics and people from all walks of life, but today, nobody is in sight. Instead, word has come here that there may be people from the authorities coming up here to make sure the few believers that were here congregated from last night are herded and shepherded away from this mountain for their own safety. Indeed, they are leaving God and have to meet Him elsewhere. Old and young, they have heard stories of coronavirus and understand what they can about this phenomenon that threatens even their rituals of faith. The people descend and instead are leaving God on the mountain, abandoned, forlorn, alone. But they have some consolation. In His omnipotence, they will find Him in their daily lives, at home and in their daily chores, as they start to heed the lockdown in deed and word. They will meet God and continue to commune with Him, just not at the mountain. Well, there you have it. There you have it. We've been going through, of course, your comments. We've got Bob Jakarasi. Bob Jakarasi is onto something that's absolutely important. He's talking about figures, because this is what we've been following here on Diplomatic Passport. So now onto a roundup of the cases as at Friday morning, which have actually just only been tweaked slightly, because there's really been little change over the weekend. COVID-19 cases have now risen as of today to 25, with one of the cases being a 4-year-old girl, and this is according to those figures from the Ministry of Health and Childcare. And so those are the figures that we had as of that day. And going forward, what we know, for example, is that case number 19 is a 4-year-old girl, while case 20, 21, 22 involve 10-year-old, 30-year-old, 34-year-old and 16-year-old female residents of Bulawayo, which, as I said, is now being the epicenter. And that's what the ministry gave us in a statement. Harare has now recorded 9 cases, 1 behind Bulawayo, while Mashonaland East has 4, and Matabeleland North has 1, and Manicaland has 1. 1 person has recovered from the virus, while 3 people have sadly succumbed. And Zimbabwe has, as I said, decentralized and ramped up COVID-19 testing, with by Friday 583 people having been tested across all the country's 10 provinces to date. 1,219 people have been tested. 1,299 actually had been tested in Zimbabwe, with 74 emerging negative. However, earlier on we also went to Mbare, where we talked to the people in Mbare. We've just seen what was happening outside the city in Toko, but now let's see what's happening in the peripheries of our city.
Updates on Zimbabwe's lockdown continue. The lockdown that was announced by Zimbabwe's government on Friday, and is supposed to go for 21 days. I am at Mbare Musika bus terminus, the termini where most people will board their buses as they go around the different provinces of the country. Today, this place is totally deserted. No buses in sight, no travelers in sight either. This, of course, after government announced that there won't be any intercity travel during the 21-day lockdown. Over the weekend, just on Saturday and Sunday, as people were making frantic efforts to go to the rural areas, standing on this very spot that I'm standing on right now would have been nothing short of being suicidal. Hundreds, if not thousands of travelers were stranded right here at Mbare Musika as they were seeking to travel to their rural areas. So today, the travelers and also the operators heeding to government's call to not travel and stay indoors during the 21-day lockdown.
So there you have it, Blessing Manasi there giving us an update of what was happening at a place that usually is a very important and busy flurry of activity here in our country, Mbare Musika. But there you saw it, there was a heeding of lockdown. Of course, as we were saying, this has been the timeline that we've gone through. We're waiting now. We've just gotten word from State House that anytime now the president is going to be emerging. So really quickly, let's go through that timeline to show us what happened until we got to the place that we are at today.
Starting Monday, 30th March.
This is Zimbo Live TV, taking TV to the people. Zimbo Live TV. We go there, we tell the story, live from the ground.
The lockdown that was announced by government, and it's supposed to go for 21 days. Government asking and requesting people to stay indoors. Some of the businesses obviously not opening.
But a visit to one of the country's busiest fruit and vegetable markets, Mbare Musika, shows that reopening the space was not really a good move, as hygiene levels are low and people are not observing social distancing.
President is a respecter of science. So that decision will be informed by science. Whether we are extending the lockdown in its current format or whether we will scale down or change format, that will be informed by science.
There you have it. That's the timeline that we've been going through. Right now, I can confirm that I can no longer give you that diplomatic passport to State House. Well, perhaps let me give you the last glimpse of State House, because everything has started rolling right now. As you can see, we've got those images. That's George Charamba there, probably telling His Excellency that your people are waiting, and indeed you're waiting, and you're waiting anxiously with bated breath. We see there a glimpse of Vice President Chiwenga who is the co-head of one of our. He's the co-head of.
It's news time. This is Zimbo Live TV. Breaking news. Zimbo Live TV. We go there. We tell the story live from the ground. Zimbo Live TV. We go there. We tell the story live from the ground.
The positive feedback that you're giving us. You've seen the president as he's come right there in our frame. He's now coming to take his place at that podium to address the nation, because you've had enough of me. You did not elect me to be your president, and a lot of you are now saying, we've had enough of Robert Mnangagwa, and certainly that will be happening anytime soon. But while the president takes his position, I want to come back and stress something that I said on Friday. I hope the president, I hope the presidium, I hope the nation extends lockdown, because right now, how do we lift this lockdown when really even Pararenyatwa is only just starting to be made the epicenter of where we're fighting this disease from? We had started by saying Beatrice, we had started by saying Wilkins, but remember, these places did not even have oxygen points. But certainly Pararenyatwa group of hospitals has had this for years. Why we decided to say to reinvent the wheel, as it were, and declare that we're using Beatrice and to declare that we're using Wilkins is beyond me. And that's why initially we sent Takuzwa Chihambakwe, that evergreen man, is our man on the ground with regards this and with regards diplomatic passport, and we sent him and he filed this report. And let's watch this before we hear the president.
But if you actually look at the structure of Pararenyatwa Central Hospital, every bed in Pararenyatwa Central Hospital has got an oxygen delivery point. Harare is not exactly the same. Pararenyatwa Central Hospital has got a 13-theatre suite, 10-bedded high care unit, 10-bedded ICU. It has got secondary set of theatres on the ground floor near casualty and also in Seguruka Guvi Hospital. So in other words, Pararenyatwa Hospital is already set up as a COVID center.
These were the views of the Zimbabwe Medical Association when its representatives met with President Mnangagwa State House last week. This comes after the realization that in the event coronavirus cases rise, Wilkins and Beatrice infectious disease hospitals will be overwhelmed. As a follow-up to that, Vice President Kemo Mahadi, who chairs the Interministerial Ad Hoc Committee on COVID-19, held a meeting with senior doctors who then insisted that Pararenyatwa group of hospitals is the best place to treat COVID-19 patients.
So they said that we should actually think of refurbishing Pararenyatwa. And I agree with them that we need for Pararenyatwa. But they went further to say that since Pararenyatwa is a hospital that also admits people that have non-COVID-19, so they need to divide it into two.
A few days later, work to transform the hospital into a premier COVID-19 management and treatment center is underway. Engineers are working round the clock to ensure that in a fortnight it will be ready to treat COVID-19 patients. The hospital will be split into two sections, the red zone for COVID-19 patients and the green zone for patients with other ailments.
This section here will be the critical care center where COVID-19 patients will be treated. There's a lot of dirt and disorder in the room because there's a lot of work being put into it by engineers and a lot of other workers that are putting all hands on deck to ensure that this place is pushed up and ready to start admitting patients in the next 2 weeks.
When transformation work is complete, Pararenyatwa group of hospitals will be able to take in a total of 425 COVID-19 patients. This is slightly less than double the capacity of Wilkins and Beatrice infectious disease hospitals, which carry 60 and 160 patients respectively. The critical care center will have a total of 27 intensive care beds.
The hospital's management is optimistic that their plan will go according to schedule. Taku Zimbabwe for ZTN News at Parinyato.
Coming to our country, we have witnessed a spiking of infections from single digits to the current 25, with 3 of our loved ones already dead. Apart from this growing number of infections, we are deeply worried that the virus is beginning to attack our children, with more and more cases coming from local transmissions. Clearly, the numbers are rising and will soon gallop uncontrollably once we reach the deadly mark of 100, after which the grim multiplier effect kicks in. Once the cases begin to grow exponentially, the strain on our health facilities will be huge. We should thus do our best now to ensure the pandemic levels of at these low, manageable numbers we currently have recorded. Indeed, we should treat the current small numbers of infections as a window of opportunity to tighten our collective national defenses, while providing for the worst case scenario of a fully blown health crisis. This your government has and continues to do within the limited means and the constraints it has. From the very beginning, we have always known that a national lockdown cannot be the cure, the solution. Rather, it merely buys time for us to slow down transmissions while we take other measures and prepare on many fronts to cope and deal with the pandemic. Equally, we have always been conscious of the huge costs which come with a total national lockdown to the economy, to livelihoods, to families, to individuals, and to all our children whose normal lives full of play and learning today stand severely curtailed. But we chose the route of abundant caution, whatever costs and discomforts this route brings upon our whole society. Nothing is more important than life-saving. I have already said the lockdown is not the panacea. It is only a holding operation while we seek real, durable solutions. I want to spend some time explaining our country strategy, which, if carried out successfully, becomes our exit strategy from this otherwise engulfing danger, and, of course, from the painful measures which this danger has necessitated. The national lockdown cannot in itself be the strategy, nor can it last forever. Our national strategy must be founded on, firstly, leveling the pandemic by arresting its spread in the immediate. While we do that, we should take measures that place us ahead of infections, so we hold the disease at bay, while a cure and vaccines are being found and developed respectively. Government has now moved beyond diagnosing cases which present themselves for investigation. This reactive and remedial response clearly comes short of the goal of staying ahead of the virus. Government has now embarked upon expanded tests covering our whole country. This allows us to gauge the magnitude of the problem while promptly isolating cases early enough from the onset of the virus and before more and more people are infected through contact or community transmissions. This broad proactive approach allows us to detect symptomatic or could very well be more deadly since the carrier shows no symptoms in practical terms. This means making available more test kits to more centers countrywide so every citizen is within reach of testing services. Secondly, it means our industries and our research centers and laboratories. With time and before long, all our institutions right to small remote rural clinics must become testing centers. It also means we have to increase our laboratories countrywide to ensure results of expanded tests come soon enough to allow for timeliest interventions. We thus need a competent cadre across the whole health value chain. This means more recruitments, more specialized training and retraining so our hard-working health workers know how to play their part in the fight against COVID-19 without putting themselves in harm's way. Our industries and tertiary institutions must be repurposed so they can make significant contributions to this new thrust by way of critical skills and services and by way of more and better equipment and consumables we require for this national effort. Over the past few weeks, I have held several meetings with different professionals and business interests in order to mobilize our nation towards this new campaign. The results have been salutary, and I'm quite confident we are geared for better outcomes. Contact tracing comes hard on the heels of testing and treatment. We need to account for all persons who would have come in contact with all infected persons. Experts tell me that an ideal situation is devoting one contact tracer to every 4 infected cases. Tracing and isolation limits the multiplier effect of the pandemic. It also allows early treatment, which lightens the burden on our facilities of care. We have to ginger up our infection surveillance systems for speedy detections and contact tracing again. Government is addressing this critical area. Thirdly, as I address you, more of our health institutions are being repurposed to handle the pandemic. The goal is to increase the number of beds for COVID-19 cases in anticipation of increased infections. We have to have on standby more and more well-equipped and stocked facilities which are competent enough to deal with infections. We require more health personnel who can discharge their already onerous care and cure duties, knowing full well that they are well provided for and protected.
This means adequate personal protection equipment, PPEs, so we do not lose our committed health cadres while in the line of duty. Government will stop at nothing to ensure our institutions are fully equipped and stocked, and in ensuring our health personnel. From the foregoing, three objectives become apparent. 1. We must flatten and then arrest the infection curve. 2. We must raise the line of tests through expanded testing. And 3. We must see more COVID-19 recoveries, so our health institutions are not overburdened. Fellow Zimbabweans, the 3-week national lockdown, which has been underway, ordinarily expires at midnight. Government has reviewed the situation obtaining in the country, around us, in the region, and worldwide. As I have already indicated, incidences of infection in our country to date have risen to 25. This figure comprises both imported and local transmissions, with the trend clearly showing that more and more we are now dealing with in-country transmissions. We are also facing a new situation where more and more of our citizens are coming back home, including from countries heavily affected by the COVID-19 pandemic. This presents an unavoidable but growing threat to our nation, as we must accommodate all our returning citizens. The country is yet to meet the conditions for lifting the lockdown that were recently announced by World Health Organization. Key among these conditions is the need to have in place health systems that are capable to test, isolate, treat, and trace every contact. The need to lift the lockdown or restrictions is when the transmission of the virus is fairly under control. As I have also already indicated, worldwide cases of infections continue to gallop, with the World Health Organization cancelling against the relaxing lockdowns currently adopted by almost all countries of the world. Guided by these realities, and to allow ourselves greater leeway to prepare for worse times which are likely ahead, government has decided to extend with immediate effect the national lockdown by a further 14 days. That means the national lockdown, which would have expired at midnight, stands extended by another 2 weeks up to 3rd May 2020. It has been a very hard decision my government has had to take reluctantly, but it has been a necessary and unavoidable decision in the circumstances in which we find ourselves. We need to maintain the same level of national and self-restraint as we have shown in the 3 weeks which have gone by, all in the interest of our nation and of ourselves individually. Government is acutely aware of the need to keep the economy running, albeit at subdued levels. With this objective in mind, government has decided to allow the mining sector to resume or scale up operations.
even then, within parameters set by the World Health Organization regarding social distancing and other public health safety measures. I have now directed the Ministries of Health and Child Care and that of Mines and Mining Development to work closely to ensure the workforce in the mining sector is immediately screened and tested ahead of resumed operations. Further, to the extent possible, I have directed that workers in the mining sector remain within the precincts of their accommodation at workplaces for the duration of the lockdown. In respect of our manufacturing sector, I have further directed that limited operations resume in the national interest, but mindful of the public health safeguards as already announced. Inspectors will be visiting all operations to ensure these safeguards are being. This reprieve covers our manufacturers in our informal sector and SMEs as well, who have to use these 2 weeks to rebuild their capacities and the stocks. The responsible ministry is also directed to work closely with the health authorities to ensure there is order and the safety in that sector, so critical to livelihoods. As government, we continue to explore ways of mitigating the impact of the lockdown on all businesses, big and small, so our economy recovers more rapidly after the pandemic. Essential services continue as before, operating within designated times and parameters as already announced. I'm happy that the Department of Social Welfare has begun rolling out support schemes and measures targeting vulnerable families throughout the country. These measures, which include cash disbursements, will be fine-tuned and intensified so needy families are supported throughout the period of the national lockdown. Our security arms will step in to assist, including facilitating essential movements of our citizens during this difficult period. I shall be visiting a few more places, both in towns and cities and in our rural areas, to see firsthand how families are coping and what extra measures we need to take as government to make the burden of the national lockdown bearable. Fellow Zimbabweans, the Second Republic is a listening, a caring dispensation. We continue to listen to any suggestions you might have as citizens, so we make our responses to COVID-19 both effective and bearable. Once again, I would like to thank you all for the high level of self-discipline we have shown in the 3 weeks we have been under national lockdown. I trust and I hope that this will continue for the next, after which government will announce the appropriate way forward, of course guided by realities on the ground. Together we will win against the pandemic. I wish you all and your families good health. I thank you.
It's live. This is Zimbo Live TV. Breaking news. It's news time. This is Zimbo Live TV. Breaking news.
Arrangement where the tobacco auction floors are going to be decentralized countrywide to minimize crowding. And in the process, they are going to observe the measures such as social distancing, and also the question of accommodation will be regulated as to who comes and which day, because the areas of concentration will be limited in terms of the decentralization and the spread. Thank you.
Still question.
Join access for. It's news time. This is Zimbo Live TV. Breaking news. Zimbo Live TV. We go there. We tell the story live from the ground. This is Zimbo Live TV. Taking TV to the people. This